Hello everyone, welcome to the Gregory Med course. Today we are discussing about the blood supply of the long bone. So, blood supply of the long bone consists of nutrient artery, epiphyseal artery, metaphyseal arteries. As the bone has three parts: epiphysis, metaphysis, and diaphysis. Okay. First, we will discuss about the nutrient artery. Nutrient artery enters bone through the nutrient foramen and it divides into ascending and descending branches, and it turns at the metaphysis to form a hairpin vein, and each branch divides into number of small parallel channels which terminate at the adult metaphysis by anastomosing with the either periosteal artery, metaphyseal, and epiphyseal and metaphyseal. Okay, we will see in the bone. Here, the nutrient artery entering into bone through nutrient foramen. It is going up as ascending branch and descending branch. And here we can see the hairpin bend at the metaphysis. Okay, this is hairpin bend is mainly seen in the children's, as their epiphyseal plate or growth plate is still not fused. Okay, so we will see the clinical implication here. Here, due to the hairpin bend, there will be a decrease in the blood flow, that is stasis of the blood, and it leads to the increase in the chances of infection. And this is the most common reason for the osteomyelitis in the children at the metaphysis. Okay. What is the supply of nutrient artery? Nutrient artery supplies the medullary cavity, metaphysis, and inner 2/3 of the cortex. So here the most common viva question or 2 marks question is, what is the direction of foramen, or MCQ? The direction of the nutrient foramen, it's always directed away from the growing end. So how to remember, sir? How to remember nutrient foramen? So here is a mnemonic. To the elbow I go, and from the knee I flee. So what the mnemonic is saying is, the elbow is at the elbow, towards the elbow in the upper limb. The nutrient foramens are facing towards the elbow, and in the knee they are away from the knee joint. Okay, as the growing ends of the upper limbs are, take it as an example, humerus growing end is proximal on the upper side, so its direction is towards the elbow. Okay, and this is important. Okay, next, periosteal arteries. These are numerous beneath the muscular and ligamentous attachments, and it enters the Oakman canal and supplies the outer 1/3 of the cortex. Okay, so who is supplying 2/3? Yes, it's correct, nutrient artery. Next, epiphyseal arteries. Epiphyseal arteries are derived from periarticular arteries. Articular means joint, periarticular on the side of the joints. So these are present on the non-articular surface, and this supplies epiphysis. Okay, and next is metaphyseal arteries. These are derived from neighboring systemic arteries. It enters the metaphysis, as already nutrient artery is supplying the metaphysis by the metaphyseal branches. So this metaphyseal artery reinforces the metaphyseal branches from the nutrient artery. Okay, this is the arterial supply. We will quickly revise the arterial supply. First is nutrient artery. It entering into the bone, dividing into ascending and descending, supplies branches and supplies like medullary cavity, epiphysis, metaphysis, medullary cavity, and inner 2/3 of the cortex. Outer 2/3 is supplied by the periosteal arteries, and epiphyseal artery supplying the epiphysis. Okay. Next, venous supply. Venous supply is by the veins, and numerous large veins in the cancellous bone will supply cancellous bone. Cancellous bone is the central part of the bone, and in compact bone, the veins are accompanying the Oakman's canal. That's it, friends. If you like it, share, subscribe. Thank you.